Hello and welcome to Eyes on Research, the podcast that digests the latest scientific innovations in eye research using simple and understandable terms. I am your host, Thales Guimarães, medical doctor and clinician scientist at Moorfields Eye Hospital. Hello, my friends, and as ever, welcome to another episode of Eyes on Research, your favorite science communication podcast focusing on the eyes and vision. I hope you're having a great week so far. It is a great pleasure to have you here with me. In today's episode, we'll be discussing about floaters and other types of visual disturbances. Now imagine the following scenarios, some of which may have happened to you already. You had a pretty normal day, worked hard, went to the gym at night, or perhaps you had dinner with your family and then you went to sleep. The other day you woke up and saw some tiny blobs and spots in your vision that came in various shapes and sizes. Or maybe you were seeing flashes of light in the sides of your vision. Or perhaps you have regular headaches or migraines, and then suddenly you notice something new. You started to see some shimmering lines before the headaches started. These are all examples of visual disturbance, some which are very, very common, with most people experiencing at least one of these at some point in their lives. If we were to define visual disturbance, we could say that it is anything that changes your visual experience. Let's talk about the most common types of visual disturbance one by one. And starting with the most common, floaters. Now, these are the small blobs and spots that you may see in your vision, or what some people describe to as flies, right? That they eventually try to catch to see if they were really there. I did this, you did this, we have all been there, so there's nothing to be ashamed. Now, in the intermediate section or chamber of the eye, as we say, we have this jelly-like material that we call vitreous humor. And this is a clear, colorless gel that fills the space between the lens in the front and the retina in the back. So it's within these two structures. It is mainly composed of water and a bit of collagens and other proteins, and also some electrolytes. The main role of the vitreous humor is to maintain the size and the shape of the eye, as well as being transparent, right? Which means that the beams of light can pass directly through it to reach the light sensitive cells in the retina that allow us to see. With time and age, what happens is it may undergo a process that we call vitreous degeneration, which is when the vitreous loses a little bit of viscosity, essentially becoming thinner and having a more liquid consistency as opposed to a more gel-like consistency as it should have. This leads to what we call floaters to appear. And these have several shapes, right? From small spots to rings, waves, and even web-like floaters, right? Like it's the web of spiders. There are some things that can increase someone's predisposition of having floaters. The most common being the fact that someone is short-sighted or have myopia, which is a type of refractive error. And we have an episode released just a few weeks ago about refractive error, so go check it out if you want to dive a bit deeper in this. But in the overwhelming majority of cases, floaters are nothing serious, and no treatment is advocated for them. Either they will disappear, or our brain will learn how to deal with it and negate its existence in our visual field. However, in some cases, a more significant degeneration of the vitreous can occur, causing a separation of the vitreous from the retina, right? Because the vitreous is attached to the retina. This can lead to a more significant increase in floaters and also to our second type of visual disturbance, which are flashes of light. The problem with this, and this is by the way why we ask patients with flashes of light to go as soon as possible to the eye doctor, is that it can cause traction, stretching, and tear on the retina. And this may lead to the fine superficial vessels on the retina to burst, and this can cause an hemorrhage into the vitreous. Depending on which part of the retina gets this stretching or distraction, it can also cause a hole to form in the central section of the retina that we name macula, and the name of this hole is macular hole, or even a retinal detachment if it's in the more peripheral region of the retina. So if it is the case that you have flashes of light, particularly when they are associated with changes in your vision or in your visual field, or when there's a sudden appearance of a large amount of floaters, go to your eye doctor immediately. Regarding the general treatment of floaters, as I said, there's not much that can be done really, particularly because in most cases they will either disappear or our brain will learn and adapt to their presence. There are some doctors though that do lasers to shoot those specific floater spots and disintegrate them. Or when it's extremely severe, there's a surgery named vitrectomy, which is a much more invasive procedure and reserved to very specific occasions. Not every doctor though will do lasers for floaters, and I guess it depends. It's a case-by-case scenario, but there are some doctors that do. And some don't, because it may be out of your central visual field, it may not be affecting you that much, so we would not do a laser which can harm the retina, right? So we would, well, it's rare, but you may as well overshoot and hit the retina, and that's why some people do not like to do lasers for this. But again, it's on a case-by-case scenario. We have talked about floaters and flashes of light. Now let's talk about double vision, or what we call diplopia. Double vision can happen with both of your eyes open or only in one eye. And if you close one of your eyes, you notice that you lose a significant part of your visual field, right? That's because both of your eyes contribute to the visual field and you have a larger field of vision, and the information sent by the right eye and the left eye essentially converge in the brain, right? That's how we see things. Now, when the double vision is only in one eye, it may be caused by damage in a structure that is specific to that eye, such as the retina or the lens. And when it happens with both eyes open, the images gets misaligned. This may be caused by something a little bit more serious, like nerve damage, or perhaps it's related to something as common as squint, what we also call strabismus. And the reason that squint causes double vision is because there is misalignment of the gaze. So the images sent to the brain are too dissimilar, right? And this creates the sensation of double vision. The treatment is specific to the cause. So for instance, if it's being caused by squint, it may be necessary to have a surgery to adjust the muscles responsible for eye movement. All right. Let's move on to disturbances that are caused by migraines now. And we call these disturbances collectively as aura. There are some aura symptoms that are not in the eye. So the ones that are specific to the eye, we say that these are visual aura. In fact, these are quite common in migraines, with research pointing out that 20 to 30% of people with migraines will experience this at some point during their lives. They usually occur for about 10 to 30 minutes, and they frequently precede the headaches. It's usually widespread through your visual field of both eyes, so it happens typically in both eyes, although they occasionally may appear only on one part of your visual field. So it becomes a bit harder to judge. A few of the disturbances that one can have in migraines are flashes of light, again, right? Some patients have bright shimmering lights, Other people have distortion of the images, the shape or the color of the images, and partial loss of vision. These symptoms will rarely occur for more than 1 hour, but you can see how migraines can be debilitating, right? It's not your typical headaches after a tiring day that we're talking about. We're talking about a highly painful headaches that can cause even visual symptoms. Now, it is true that people may only start experiencing visual aura at an older age, even though they had migraines throughout their lives. Even that being the case, any new visual disturbance should trigger you to seek medical attention. The treatment of disturbances caused by migraines is with medications to ease the migraines. There's no specific treatment for the aura. One of the classes of medications that's commonly used are beta blockers, right? Which is a class of drugs that is used to dilate the blood vessels. And these keeps a steady flow of blood to the eyes on this case, right? And that's how it may help in the symptoms of migraines and maybe in the symptoms of aura as well. So we have talked all about floaters, flashes of light, double vision, and visual aura caused by migraines. What other types of visual disturbances are there? Well, halos, right? As the name implies, halos are circles of light around objects. This is a symptom, or I should say a trait, of several diseases in the eye, the most common which is likely to be cataracts, which is a degeneration of the crystalline lens that we have inside our eyes. Then one can also have color blindness, right? That we also know as color vision deficiency. And we have an episode that was just released a couple of weeks ago on color vision deficiency, so go check it out if you want to learn more about this. But in summary, it affects the way that we perceive colors. Most commonly, this happens due to a genetic variation, and thus patients are born with this difficulty with colors. The most common being in the red-green color spectrum. We call this red-green color deficiency. However, if this is something that suddenly appeared during your life, go visit your local eye doctor immediately, because this may be to a more serious disease, such as, for example, inflammatory and neurodegenerative conditions that affect the optic nerve. So it's very important to go to your local eye doctor as soon as possible. And lastly, I just have to mention Charles Bonnet syndrome, although this is different than all other disturbances, as it happens in people who have lost their sight completely or a significant part of their sight. These are visual hallucinations, for the lack of a better term, that are caused by the brain as it adjusts to significant vision loss. And it seems to be linked to diseases like age-related macular degeneration, at least that's what some studies are pointing out. Unfortunately, there's currently no effective treatment for this, but over time, in most patients, the hallucinations may happen less often. So, to wrap this up, as you can see, there are a few different types of visual disturbances, and the individual experience of these may change from one person to another. These are much more than just a nuisance, but in the vast majority of cases, these disturbances are benign and not associated with any serious disease. Of course, there is always the odd case, so we always recommend visiting your doctor should any new visual disturbance appear, particularly if they are followed by some worrying signs such as decreased vision or a change in your visual field. My friends, thank you so much for listening to me. I hope you found this episode useful and that you can extract something from it, something relevant from it. We have social media accounts where we post short videos all the time, so visit us on @EyesOnResearch on your favorite social media, Twitter, Instagram, LinkedIn. We have it also. Go look for us. Also, you will find the link in the description of this episode to our support website, which is the website that we're using to post our articles. Please consider subscribing to us there. It is completely free. And we are using the platform as a blog, so you see weekly posts about curiosities and trivia, or some hot research updates that did not go on to become a full episode. So please do consider subscribing. You need to click the three dots in the top right corner of the website, provide your email, and hit follow. In this page, you also have the option to donate or become a member, which, although optional, is highly appreciated, and it gives you access to special posts and very cool things, like for instance suggesting themes for blog posts, short videos, or even full episodes. So please do consider checking that out. Otherwise, share the podcast widely amongst your family and friends, and feel free to give us a rating if you like the work that we do, wherever it is that you're listening to this episode, Spotify, Apple Podcasts, or any other platform. This helps us a lot as well. A huge shout out to my supporters. Thank you all very much for listening to us today. Have a wonderful rest of the week, and I'll see you in the next episode. And as ever, keep your eyes on research. Bye bye.